A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Dear students, today we are going to talk about the prescription writing for angina pectoris. Okay, dear students, in this lecture, in this section, we are going to talk about that how we will write prescription for angina pectoris patients. Okay, as usual, first of all, we are collecting the biodata of the patient, in which its name, its gender, its age. ओके, उसके बाद डेट और weight and address. These are all written first of all before writing prescription for a patient. After that, we are going to write orex. It means that to take. First of all, we are prescribing nitroglycerin tablet, nitroglycerin 0.5 milligram tablet. We are going to prescribe for the patient of angina pectoris, and these tablets should be used according to the direction of the physician. For example, place these tablets only, place only one tablet under the tongue, only one tablet under the tongue when necessary. Okay, uh, in Urdu we can write this as simple as एक गोली हस्ब ज़रूरत ज़बान के नीचे. Okay, so this was the first tablet for angina pectoris. Second, isosorbide dinitrate. We can also prescribe this for angina pectoris patient. Isosorbide dinitrate. Okay, this is 10 milligram. Okay, one tablet, take one tablet, take one tablet 3 times a day. Okay, it means that in the morning, afternoon and at the evening. Okay, उर्दू में हम लिख सकते हैं कि एक गोली सुबह, दोपहर और शाम, लेकिन ये जारी रखनी है. इस गोली को पेशेंट ने जारी रखना होगा. थर्ड टेबलेट जो है उसका नाम है डेल्थियाजम. ओके, third tablet which we can prescribe to the patient for angina pectoris, this is deltiazem. Its amount is 60 milligram. Okay, and its signa is take one tablet daily, but should continue. Okay, yani these tablets should be continued. उर्दू में हम लिख सकते हैं इसको कि एक गोली रोज़ाना जारी. ठीक है, जारी रखना होगा. तो डियर स्टूडेंट, it was all about prescription writing for angina pectoris patient, so that you can remember all these things in your mind. Thanks a lot.